The Northwest region has reaffirmed its determination to end AIDS by 2030. This comes as regional leaders, health experts, development partners, and community groups marked the 38th edition of World AIDS Day, gathered on Tuesday, December 2nd, 2025 at the Regional Fund for Health Promotion to assess the fight against HIV, celebrating major progress yet acknowledging the challenges that remains. The regional delegate for public health, Dr. Ambe Leonel Neba, revealed that over 131,000 people were tested for HIV between January and September 2025, with a positive rate of 0.9%.
HIV has dropped in the Northwest region, and following the recent studies that we did on camp here, we'll be having the results of the Northwest region for this current year. But we want to say, in terms of our 395s, the first 95 is where the region was not able to achieve its UNAIDS targets. But we were able to achieve the second and the third 95, that is for persons being placed on treatment as well as having viral suppression for the general population. But we still have a gap, in particular in the pediatric population, and I believe it is within this framework that we are going to intensify efforts for the fight against HIV in the Northwest region, in collaboration with the technical and financial partners and all the civil society organizations and NGOs working in the Northwest region.
On the prevention of mother-to-child transmission, 27,000 pregnant and breastfeeding women were tested. 89% of those diagnosed enrolled in treatment. The number of HIV-positive infants continued to decline, with 20 cases confirmed out of more than 111 exposed babies tested. Despite disruptions caused by the socio-political unrest and global crises like COVID-19, the Northwest currently stands at 88%, 97%, and 95.5% across the three benchmarks. Dr. Ambe warned that children aged 0 to 15 remain underserved. Living with HIV today is no longer the isolating experience it once was. Across the Northwest region, support groups, health counselors, and community health workers are helping patients stay on treatment, manage stigma, and rebuild their lives despite insecurity, displacement, or economic hardship.
It was not easy, especially with my immediate family. When I say the nuclear family, I mean like my father and my siblings. It was not an easy thing, but after a couple of months, they themselves were accepted because they had seen that as I was taking, I am fine, and to date, I am okay. When I married, I have 5 boys. 2 are already out of the country and they are excelling, but all my children, they are free from me. But at first when I discovered, I thought that I would never get married and I will never have a child. But today I am proud to say that I have 5 boys and all are fine. The regional hospital on its own part, they have been playing a lot of vital role in my life, because at first, early 2000s, we were buying these drugs. I remember we started buying a cup of TLD for 75,000 francs. It dropped down to 15,000 francs. Dropped down. It first of all dropped down to 45,000. From 45, it came down to 15,000. From 15,000, it came down to 35, and from 35, 0 nothing being paid for it.
The governor's representative urged the youth, who currently record the highest HIV prevalence in the region, to lead change through responsible behavior and accurate peer-to-peer education.
Since the 1980s, the statistics we've been having have been dropping, and that shows that the Northwest region is striving towards an AIDS-free region by 2030, and the government is putting in a lot towards that fight. I want to appreciate the regional delegate with his team for the good job they have done so far, and I encourage them to continue to sensitize the population so that together we can be able to attain the undetectable levels for all persons tested positive with the HIV in the region.
HIV is no longer the death sentence it once was, thanks to free testing, free treatment, and decades of strengthened partnerships. While community-led initiatives are gaining ground and renew political will, stakeholders say the region is on the right path so as no one is left behind.